Now, while the first thousands of doses are being given out in Hampton Roads to healthcare workers, the vaccine will not be available to the general public for several months. But reporter Margaret Kavanaugh has information about a new tool created by the New York Times to give you an idea about where you may fall in the line.
COVID-19 vaccines are here with healthcare workers at the front of the line and then eventually the more vulnerable populations. They're not available to the public just yet. Governor Northam hopes by this summer. Officials at Centera are excited.
It means that we get to start hopefully working towards that herd immunity, which will take time. But for us, we are super excited.
The arrival of the first vaccines have people wondering when they can get one.
The thing that's on our mind in my household is when is it going to be our turn? And it seemed like no one was able to give me a real straight answer to that.
Stuart A. Thompson is a writer and editor in the opinion section of the New York Times, and with others created this new tool to help estimate how many people are in front of you when it comes to getting a vaccine.
Where you're going to sit sort of relative to other people in your area. And that can give you kind of a sense of the priority and where you might be.
Here it asks you your age, the county you live in, if you're any of these professions, and if you have any COVID health-related risks. It then shows you where you fall in the line. They stress that this is just an estimate, though.
This isn't a hard number. It's not like a line at a deli counter and you get your number and you're waiting for it to be called. It's just, these are big buckets of people and you kind of slot yourself in. But exactly how that's going to roll out is still going to be decided by CDC and states and kind of down the road as we get into next year.
He says this is just an idea of what the order of people may be.
You enter 65 or older as your age, you get bumped up really far. And for some people that's been confusing because they'll enter in their husband or wife and they'll be in a very different place. But exactly how they negotiate those fine lines in the data kind of remains to be seen. And we're really only at the very beginning of this process. So only the first two tiny little groups of people have been decided. So the rest of it has to be debated.
Decision makers are working on plans as we continue to navigate through the pandemic. I'm Margaret Kavanaugh for News 3.